you don't need medication or talk therapy. So with what you've been studying and what you're teaching now as well, what are the best solutions for people? Like how can you combat this anxiety, depression in like more of a natural way?
So I just want to paraphrase here that depression and anxiety are genuine psychiatric conditions, and often the first thing you need to know is that once the neurochemical balance in your brain has changed to that, it's very difficult to shift it back, because that didn't happen suddenly. It happened over time. And it's like when you have a bicycle wheel, if you sort of rotate it, it's very easy to do when it's not spinning. But once you start spinning it, it's very hard to rotate it.
No.
And that is what happens in the brain. So when the brain is still, it's very agile, it's very adaptive, and you can go into a state of depression and grief and give yourself that moment. And then over time it will pass and you spring back from it. But if you get stuck there, then you're stuck in the past, and that is very difficult to transition from. And the same with anxiety. If your brain is constantly thinking about the future, and it has been for the last 3 months or 6 years, then that neurochemical composition is very difficult to shift. So I want to paraphrase that first, and then we can talk about how we go about this. So the first thing that I teach people is how to breathe. And they've done that all their life. But when you show people how, it's quite a profound experience. And I use something called vagal breathing, which is my own proprietary technique. And it's very simple. It's a reflex arc. So every time you inhale, the heart rate rises to saturate blood oxygen. Every time you exhale, the heart rate slows down to exchange carbon dioxide. This is not just in humans, it's across all mammals. So it's a reflex. And so simply by prolonging the exhale to at least twice as long as the inhale, you can naturally start slowing down your heart rate. So once I teach that to people, teach them how to use vagal breathing, then I start introducing ways to connect breath with the body. And the best way to do that is through movements and reflexes. And so they go through a tactical movement program where I introduce ways to inoculate stress into the body. So what that means is that progressively increase the amount of stress. And because they know the vagal breathing, they're able to calm down just as quickly. And over time, what happens is that you can increase the stress threshold from like very low to very high, and they wouldn't even know it, because it's like, the classic example of a frog in water. If you boil it very slowly, it won't hop out, but if it jumps into boiling water, it'll immediately spring out. So when you introduce stress to the body gradually, someone who has anxiety or trauma, the moment the tiniest amount of stress appears, they emotionally, it's quite, they blow up. But if you teach them breathing and stress inoculation, what happens over time is that the same stress can be introduced, but because the stress tolerance is so high, it won't create a reaction. And so that's largely what I do, and I do it through breath and movement.